Well, I was very interested because of the educational opportunities to make sure that people not only used good products, but they knew where to put those products. So my background is teaching people particularly injection techniques and most importantly anatomy from our training courses. So it's very good to make sure that there's a very good anatomical teaching process that allows them to understand this is the anatomy and this is where the product goes in relation to that anatomy. So I think that brings us both together in our passion for making sure everyone is really well educated. The RHA range is designed to be dynamic. When I talk about anatomy, I talk about anatomy not being static. We learn anatomy from books, but that's very static. And our patients age. They age dynamically, so that there's bony changes, soft tissue changes. There are dynamic changes with just time, just smiling. And the RHA range simulates that dynamic change. So it's very nice to have products that can stretch when you want it to, and you've got products that are lifting but not so stretching. So you know which product to use in the right place for the right type of person. So as the person ages, you would go from one product, maybe let's say RHA2 to RHA3, and then you might want to use RHA4 where there's not much movement, RHA2 where there's a lot of movement like the lips. So you're using knowledge of the product and knowledge of the area to get the best result for your patient. I actually am very flexible. I used to use a lot of needles, I then used a lot of cannulas, and now I use both, but in the right places. The areas I do a lot of treatments on tend to be around the mid-face and eyes. I do a lot of deep injections in the mid-face to correct that, and I use lots of deep injections on ligaments to lift ligaments up, recreate the facial bone structure, and then I do the soft tissue work afterwards. So a lot of it is around the eyes, mid-face area. Simple problems, which is not correcting in the right place by injecting too superficial. There are problems when you do go deep, because sometimes people inject too much deep and then they get what they call maloedema, they get swollen eyes. And the periorbital region is very sensitive to volume additions. Some people are extremely sensitive. There are people who wake up in the morning and their eyes are swollen and then during the day it gets better. Those type of people I'm very careful about injecting because that can make them worse. And then the third problem is not knowing the anatomy properly and then injecting into blood vessels, and then you get problems like blindness, which is very rare, but nevertheless you need to be aware of. From my own point of view, I'm very worried about people injecting around the eye and not taking care. I mean, today I was injecting and I made it a joke, but I made sure I told people, you know, make sure your watch is taken off, you clean the skin thoroughly, and you make sure once you finish treatment, the area is kept clean and you don't allow bacteria to get into that site, because if you get infection around the eye, that is extremely serious. You really need to know where the blood vessels are when you're injecting. And for that, that's why I always use a cannula in this region. It allows me to navigate in between the blood vessels, get to the right layer and inject. The most dangerous place to inject around the periorbital, we know, is the glabella and the nose. So if you're injecting in near the nose, you have to know that anatomy and you have to get into the right layer and respect that layer. And if you're worried about it, my answer is stop. Don't carry on injecting, don't inject, come back another day.